We saw the hospitals just being overwhelmed with COVID patients and other sick patients. We all recognized how the frontline heroes in this crisis have been our healthcare workers.
My name is Brenda Diaz. I've been a nurse here at Brooklyn Hospital for the past 6 years. I was a staff nurse and then I became a manager. It's been 4 years now.
I've been a nurse for about 9 years. I've been working at this facility for 5 years. I have been a nurse since 2000. So I've been working at this hospital since December of 2015. So December, next month will make my 5th year here.
I was a biology major. My sister's a doctor. And certainly doctors are heroes in this too. But nurses are the backbone of a hospital. I got here. There he is.
Oh, hi.
Hi.
How are you?
Okay, how are you all?
Good.
How are you? They are extremely giving, caring, putting themselves on risk. And I just thought, if we can do something to help as a reward, for their service, as recognition for their contributions to our community, that would be meaningful.
I mean, I just wanted to say, you guys can speak for yourself, but this team was incredible during the whole crisis. I mean, everybody just gave and gave and gave. So for somebody like you and others to have recognized that it really warms your heart, it really does.
In March of 2020, and it was an unknown virus. We were unaware of the symptoms and the signs of people with COVID. It was very overwhelming for staff.
So it wasn't just 1 or 2 people coming in, it was just like the masses of people coming in. It was not easy, but this is what I signed up for. And so I work with my staff to make sure, as a leader, they had their supplies, they were comfortable, they needed the support. If they wanted someone to talk to, they could come and talk to me.
When I knew that the hospitals not only were going to be overwhelmed then, but were going to be in crisis state for months after the peak. And yet the nurses are there 24/7, working 12-hour shifts, and doing some incredible things we learned.
I'm really touched by that and really nice to meet you all. Each one of you are remarkable individuals in the path that you've forged on your own and with your families and friends to become, what you are today, which is senior nurse managers on the forefronts of this terrible crisis.
A lot of the charitable things that I really enjoy that we do at Alger are because they're not just giving money, they are giving time, and if I could locate some that were in our communities, that's what we were going to do.
We wanted to try to recognize your contributions in a way that would be really meaningful to hopefully all of the nurses, and in particular yourselves.
A few years ago, doing research, really learning about the healthcare system, I had attended something at a nursing school, and the education that nurses get.
And one of the things that I remembered the most, and actually kind of upset me the most, was that they said at the time that the average nurse graduates from nursing school with something like $85,000 in debt. And then have that kind of debt, I thought was really wrong.
You know, honestly, this year, I always tell everybody the story. This year was very, very challenging for me. I lost both my parents to COVID. So I guess the strength that they instilled in me before they passed away is what's keeping us going. Like, there are days when we do take a deep breath and go, wow, this person's not here anymore. So that was very, very, whew.
Very stressful. But we stuck together as we know we should, and we made it work.
The 165 employees of Alger, we've raised, it's over $2,000 per an employee, and we're going to help you all pay off your student loans.
Yeah, my whole room crying.
Thank you. Well, thank you guys.
I want to take the opportunity too to say again, if I haven't said it enough, you guys are incredible.
Yeah.
I want to interject for a moment. I mean, it's so emotional, but how do we thank you? How
You've
do
already done more than enough.
Thank you.
There are plenty of businesses in New York who could say, yeah, you know what, I'm going to adopt that hospital's nurse managers and this hospital's.
Let me tell you, I'm so appreciative that I can't even explain. I'm so elated.
That really helped out tremendously. And I can go back in January, finish my DNP in education this time. So
I'm looking into going back to school for my doctorate in nursing practice, and this is so helpful, you know, this burden, being relieved of this burden.
I don't think there's any nurse who should be, who's served during this time, who should be under some crushing debt. There couldn't be any more deserving group than these. I mean, these nurses have already earned it. They just did, right? They deserve a bonus and a recognition now, all of them.